Agency. Dr. Rukmi is the planning analyst in Development Planning Agency of Bekasi Regency, Indonesia, and has been working there for local government planning agency for more than 10 years. Dr. Rukmi completed her undergrad degree in statistics and obtained master degree of urban community and regional planning and obtained a PhD in civil engineering. Dr. Rukmi focus are in natural resources, environment, and urban water management. And Dr. Rukmi now is a reviewer for Utilities Policy Journal and also Water Resource Management Journal, and also a reviewer for IWA conference. Now I invite Dr. Rukmi to bring your presentation.
Thank you.
The screen is yours. Yeah.
Let me share my screen. Yeah, can you see the screen now? Yeah, can you see the screen now?
It's on the way, I guess.
Okay.
Yeah.
Yeah.
All good.
All good. Okay, thank you. So yeah, I come from the local government, so I will talk about the local government proportion of talking about sustainable urban water management. And we are now talking about the sustainable development goals, especially talking about the drinking water target. Yeah. Okay, please. Yeah. So let me explain you, maybe some of you doesn't really updated with the sustainable development goals drinking water target. So in global, we are talking about the drinking water target, which is the United Nations wanted that everyone in the world, the global population, will have the same access to drinking water, which is they said it is safely managed drinking water. What is actually safely managed drinking water? It is water come from improved water sources that is accessible on premises, available when you need it, and free from fecal or chemical contamination. So it's actually the water that you got in Australia, for example, where you can drink the water directly from tap. You don't have to boil the water. Okay. But before going to the safely managed drinking water, the United Nations understand that not every country can provide this safely managed drinking water. So they provide some ladder to make some countries more like can describe in which ladder they are. So we have the safely managed drinking water as the top, the highest level ladder. And then we have the basic drinking water source, which is water from improved water sources that you can collect in at least 30 minutes. So if you have the water source outside your house, you don't have to take like 1 hour to get it to make us classify you as having a basic drinking water source. And we also have limited drinking water where you have to like walking too far away to fetch water, or you are in an improved drinking water source if it's come from the duck well, unprotected duck well, or unprotected spring. And you can also get water from surface water, which is the lowest ladder of drinking water sources. Yeah, so how about improved water sources? Which one do we classify as improved water sources? In the Millennium Development Goals, we only consider pipe water sources and then boreholes. We don't count water in bottle as improved water sources, but now in Sustainable Development Goals, we count them as improved drinking water sources. So we can get water from pipe supplies, or we can also get water from non-pipe supplies, and we consider them as improved water sources. We here is the United Nations, of course. So now let's get to Indonesia. How the government efforts to expand and improve water supply services in Indonesia. Yeah, so when we see the safely managed drinking water, there are three indicators that provide indicators that you can count as safely managed drinking water, but you must be accessible, and you must the source must be accessible, must be available when needed, and must be in good quality. So there are three indicators. Let's see from the first indicator, accessibility. The government of Indonesia has provided the first priority of water allocation is for the household use. It usually comes from the groundwater. It means that when a household wanted to fetch water from groundwater by making boreholes, for example, they don't have to get permit as long as they use it only for household daily use. So that's why maybe we will find that most of Indonesian households get water from groundwater. Government also provide fundings for pipe water supply services to expand. For example, in Indonesia, we have like in Melbourne, you have Melbourne Water, Barwon Water, etc. They are usually government owned. Yeah. So in Indonesia, we also have PDAM. So Perusahaan Daerah Air Minum, which is the government-owned company that provide pipe water supplies. All the local government always support this company, their own companies, to expand the pipe water services. But instead, not only with public company, the government also provide funding for the community-based water supply institution, like Bu Sri already told you before. So every year we always provide funding for the community base, for community to provide their own water supply. It usually comes from the confined aquifer. So they have like this water tank. They got it from the groundwater, and then they distribute the water to nearby residents. And the third one is that the effort to expand the accessibility is by allowing private companies. So some private companies can provide pipe water supply. For example, in Indonesia, there are not in every city they have the private companies, but in Bekasi we have several private companies that provide pipe water supply to some residential complex. And then there are also water kiosks and bottled water companies. Water kiosks, maybe you don't find it in Australia, but it usually in developing countries like in Indonesia or in Africa, you can find some kiosks that provide refill drinking water. So you can bring your own container and refill with the drinking water. So this is the tap water quality. You can just drink it directly without boiling it. Yeah, so talk about the availability. If we see the accessibility indicators, the government trying to expand the drinking water sources for the population. And then when we talk about the availability indicators, the government only provide this availability, only see the indicators of this one only for the public company, for the PDAM themselves. So the Indonesian government has a regulation for the public pipe company to provide water so it can be available for everyone when they need it. For example, the government will assess the performance of the public companies. So when they operational for their operational hour is less, they have less score. But when they can provide water like for 24 hours, they can get a higher score. That's also with the water pressure. If they can provide good water pressure for every customer, they will get higher score. But if the water pressure in most of their customer is low, and then they got a lower score. So this is the effort to make sure that water is available when needed. But the government regulation is not applied for every companies that provide water. For example, if there is a private water companies that provide pipe water services to some residential area, the government did not take account to their availability services, but it's their own private companies effort to supply water in like in 24-hour and in a good pressure, because if they perform lower, then the customer will be complaining. Yeah, but the government would not give any complaint to them if they provide less hours, for example. Okay, so continue to the quality. For the quality side, the government provide the regulation to maintain the good water quality for every institution that provide water for the population. So there are two regulations. First one is the drinking water standards, and the second one is the procedure to monitor drinking water quality. The Indonesian government drinking water standards come from the United Nations drinking water, what they called it, quite like a bit like standards. It comes from the United Nations, so it's the same. It's the same with what applies in Australia, for example. So it's not a lower drinking water standard, but it's the same drinking water standard for the other countries. So again, even though the government has already provided regulation in procedure of drinking water standard, the government only assess for the public water companies. So when the public water companies that do not perform well in water quality samples, the government will give a lower score. But when they perform well in the water quality samples, then they will get a higher score. The score will be used to evaluate the whole assessment of a public water company, and then it will depend on your scores. They will classify public water companies as healthy or as sick. So when you are healthy, you can get any loan from the government, you can get more grant from the government. But when you are sick, the government will provide an assistant to make you perform better. But it doesn't apply for the private water companies. It's only apply for the private water, for the public water companies. Okay, now we'll get back to Indonesian SDGs update. So when we see here, the Indonesian Sustainable Development Drinking Water Progress, we see that almost 90% of Indonesian population got water from at least basic source. Basic source means that the water comes from improved water source, and you only have to go like no more than 30 minutes to get it. So it can come from the pipe water on your premises. It can come from pipe water outside your house, but you can take it less than 30 minutes. Yeah. And there is also some population that got water from limited source, from an improved source, or we still have like 1% population that get water from the river, from surface water. We've been doing better from 2015 to 2020. Now there are 92% of the Indonesian population get water from at least basic drinking water source. But when we go back again to the United Nations aim to get all the global population get water from safely drinking water sources, apparently in Indonesia, we can only provide water at least at basic. It doesn't mean that there is no population got water from safely managed drinking water source, but the data only show that about 92% of Indonesian population get water from at least basic source. At least they got water from improved water source, and they only take like less than 30 minutes to get the water. When we see again the safely drinking water safely drinking water sources, ask that water should be accessible on premises, available when needed, and free from contamination. When we see the United Nations report about drinking water in 2020, Indonesian government cannot provide the data of free from contamination data. They can only provide that, okay, our population got water from accessible on premises, which is the pipe water system or the duct well inside the house. And then they're available when needed. They can provide this data. But the Indonesian government cannot provide the free from contamination data. Why is that so? Because when we see that some of the population already get pipe water services, in our mind, every pipe water services will be monitored. The water quality will be monitored frequently. But why they cannot provide the data? Okay, let's see. In this part, I will show you how it works in the local government. We will get study from the Bekasi. So I held a research in 2019. I collect samples, 79 samples from some household drinking water sources. So it comes from the PDAM, which is the public company, and some private companies that provide pipe water services, and then from community-based water supply institution. And I also get some water samples from household who get water from groundwater. So it takes like 79 samples for all of them. Apparently, from all the samples, we see that only 16% of the samples following the drinking water standards. Well, actually, it's a good sign for me, because okay, we still have some of our providers that provide water at drinking water quality. It means that when you get water from the water tap, you can drink it immediately without boiling it. But 80% and more still provide water below the drinking water standards. Okay, so this this plot here, it includes water from the community-based water supply, which is provide groundwater from confined aquifer and then deliver the water without treating them. And then it also includes groundwater that is used by household. So I think it's not fair enough, yeah. So I make another plot that provide water from the institution, from the companies that provide water, provide treated water. So this is include PDAM, the public water company, and then the private water companies that provide pipe water services. From this data, we can see that more than 21% of the samples is at drinking water quality. And then 78% of the samples is still below standards. Below standards is usually they still high in total coliform, or there are some that nitrate or nitrate is higher than the drinking water standards, like that. So this is what happened in the real world of Indonesia. So that is why we as Indonesian ourselves usually do not have such a confidence to drink water from the tap. Usually like this, I have to boil water first before drinking them. Yeah. So what's the matter actually? So when we see, this is from my PhD thesis, apparently, even though the government already provide regulation for each water supply providers to conduct water quality monitoring, not all of the providers conduct it at the standard required. Some conduct the monitoring, but not as frequent as asked, or the number of sample is not as the amount expected by the government. And then the other reason is that when the monitoring was conducted, the result is not used to immediately correct the problem. So there is the public water companies that always conduct water samplings every month, and then the result will come like 1 week or 2 weeks, and then they don't have to do anything if it went wrong, because it's already 1 week later. So they don't use the data to correct the problem in the distribution system. And also there is lack of awareness among the water supply provider of the applicable standards and how the standards be attained. Like some of the water providers think that they don't have to provide water at customer tap on drinking water quality. They just said, "Bu, I just have to provide the clean water to the customer." Oh no, you don't, the governments do not say it like that. The government said that you have to provide drinking water standards at the customer tap, not at your reservoir. Mostly the pipe water companies will provide drinking water standards at the reservoir, but from the reservoir to the piping system and then go to your tap, it's not their concern. As long as it's not poison, it's okay. Okay, and the last one is that water quality surveillance, which should be conducted by municipal government, that's my government, is also absent. Our health agency only conducted surveillance only for the PDAM, the public water company. They do not provide annual monitoring to the private companies, which is actually in the regulation, it said like that. So what should we do? So first thing first is that it is the local government themselves should provide a good surveillance on drinking water quality, especially for the pipe water supplies. If at the moment it's already done for the public water suppliers, then they should move to the private water companies. And then the first thing is that all stakeholders should be at the same goal to deliver drinking water up to customer tap. Because when I'm discussing with my colleagues in the Ministry of Health, they said that all the water supply providers should provide drinking water quality. But that's not the practice at the moment. And then the water
Sorry, Bu
supply.
Rukmi, you have 1 or 2 minutes left. Thank you.
Okay, this
Sorry.
is the last slide. So the water supply provider themselves think that they don't, it's not their duty to provide water at drinking water quality. So there is a gap between the highest level government and the people that provide the water. So it should be at the same goal, so they can reach the goal that they intended to. Okay, I think that's all for me. Thank you for listening. Yeah,
Okay.
back
Thank
to you,
you.
Bu Nini.
Yeah, thank you, Bu Rukmi. Very